So let's get started. Before I hand it over to Susan, I just wanted to take a few minutes to introduce this talented author team. Susan has experience in pediatrics, obstetrics, as well as medical surgical nursing, and she's been teaching dosage calculation at CCRI since 1994. Jennifer Palmunin is also the co-author on this text, and she has been teaching in home health, medical surgical nursing, and critical care, or rather, she has experience in these areas, I should say, and she's also been teaching a dosage calculation course at CCRI as well. Unfortunately, she's not available to be with us to present on the webinar, but she has been very instrumental in getting this textbook into publication. So at this time, I'm going to turn it over to Susan.
Greetings. So let's answer that question, why write a dosage calculation text? Reason number one, to promote math fluency. In this text, we employ a systematic approach. And a systematic approach to anything promotes fluency. We believe it's of paramount importance that students strive for math fluency. Reason number two, to promote critical thinking. We believe that students' critical reasoning skills have been weakened by the reliance on technology. Our systematic approach is a four-step approach, and two of the steps, approximation and evaluation, promote critical thinking. These steps are particularly geared toward math-challenged students. A persistent error we see with math-challenged students is that they incorrectly set up the problem, as shown on the right side of this slide. And this easily occurs when students are confused as to where to place the quantities, or do not include labels when they record the calculation. Some students actually set the problems up correctly, but they do the math backwards. So using an approximation and evaluation step will reveal to the student that the answer of 2 tablets doesn't make any sense. Because if they approximate and they look at it and they say, if the order is less than the supply, so if the order amount is less than the supply amount of 0.25 milligrams, then the answer, the quantity, should be less than the supply quantity of 1 tablet. And we believe that most current texts on the market don't really address those concerns, the concerns of really reliance on technology and critical thinking as much. Next slide. So just to give you an overview, we call our systematic approach the CASE approach. CASE is an acronym for convert, approximate, solve, and evaluate. Some calculation texts use a 3-step approach, such as convert, think, and calculate. We added the 4th step to prompt the student to double-check their math. As previously mentioned, the approximate step and the evaluate step, they promote critical thinking, which is so important with dosage calculations. If you can't approximate, you can't evaluate. If you can't evaluate, then you're potentially unsafe. So, to promote safe medication administration, teach them to approximate and evaluate before they medicate. That's our tagline. Another great feature of this text is that the 3 main methods of dosage calculation, ratio proportion, formula method, and dimensional analysis, are shown next to each other in one table. This facilitates comparison of the 3 methods and enhances students' ability to apply all 3 methods. A third feature, building on the CASE acronym, we open each chapter with a case consideration, that's a case study, that presents a dilemma or error that can be solved or avoided by applying chapter content. This helps engage the students by demonstrating the relevance of the material being presented. The case study is solved in a case closure at the end of each chapter. The example on the right shows the convert and approximate steps for the order 0.75 grams of Tylenol to be given from a supply of 500 milligram tablets. For ratio proportion and the formula method, the student must convert 0.7 grams to 750 milligrams. For DA, they need the conversion factor of 1,000 milligrams over 1 gram. The approximate step reveals that more than 1 but less than 2 tablets will be needed. If they do the math backwards, will get 0.67 or 2/3 of a tablet. And this answer should be readily recognized as incorrect if they approximated more than 1 tablet will be needed right from the get-go. On the next slide, we're showing the solve and evaluate steps. Next slide. Thank you. So this shows you what the solve and evaluate tables look like in the text. The problem from the previous slide is solved using all three methods: ratio, proportion, formula method, and dimensional analysis. And if you look, you can see that the unit of measurement that we need to yield in the answer is in blue for the formula method and dimensional analysis. And all other units of measurement must cancel out to get that. For the evaluate step, the students just replace X with the answer that's yielded in the solve step, and then they redo the math to ensure that the answer is correct and that it is actually consistent with the value or the values obtained in the approximate step. At CCRI, which is the Community College of Rhode Island, we call that the check step. And I really need to credit my colleague Sharon Remillard for that step, because she taught me that little tip to teach students years ago. And incidentally, she's not only a nurse, but she's an accountant and a financial planner. So I always heed her math advice. On the next slide, we'll show you an example of case consideration and case closure. So a case consideration is the chapter opener, and case closure is the chapter ending. To immediately engage the learner, each chapter begins with a case consideration. This is a dilemma or error that's designed to capture the student's attention and pique their curiosity about the chapter content, and resolution, which is revealed at the end of each chapter in a case closure. This case consideration is called Calibration Conundrum, and it opens Chapter 3. That's the chapter that covers medication administration and medication administration equipment and equipment calibration. So the student needs to draw up 2.2 milliliters of medication, and on clinical day 1 uses a 3 ml syringe, and on clinical day 2 uses a 5 ml syringe to draw up the same amount. And the student, assuming that the calibrations are the same, draws it up to 2 calibrations past the 2 milliliter marking on both clinical days. And so case consideration says, what's the problem? And after they learn about equipment calibrations in the chapter closes with the answer to the problem, is that each calibration on the 3 milliliter syringe is 1/10 of a milliliter, while each calibration on the 5 milliliter syringe is 2/10 of a milliliter. So they drew up the wrong amount on clinical day 2. Next slide. Okay. In addition to the features mentioned with the overview, this slide reveals key features of clinical nursing calculations. An outline followed by student learning outcomes and key terms are provided before each chapter begins. As previously mentioned, each chapter opens with a case consideration and closes with a case closure. Within the chapter, after a concept or calculation procedure is presented, 1 to 3 examples are provided to apply the concept. Learning activities are inserted as stop points for students to test their knowledge of the previously presented concept. Warnings are inserted in each chapter to alert students to important information pertaining to clinical practice. Rounding rules are included as a distinct feature. Students have a tough time determining when to round to the whole number, to the tenth, to the hundredth, and so rounding rules are a standout feature inserted to remind the learner that rounding is typically based on equipment. Clinical clues are inserted to provide examples of how this information they're learning pertains to clinical practice. A chapter summary organized by student learning outcomes is provided at the end of each chapter. 50 homework questions and 6 NCLEX style review questions are included at the end of each chapter, after the chapter summary. A pedagogical technique that may be appealing to the visual learner is the use of color coding. For example, steps in a basic math procedure are color coded in chapters 1 and 2 to prompt students to follow the steps. Color-coded units of measurement, as you saw in the solve and evaluate tables, help the learner set up an equation so all units of measurement cancel out except the colored ones. On the next slide, we just want to say, how does this text compare to others? Well, for one, the text is designed to engage the reader, not only with the case consideration that captures their attention right from the get-go, and with the case closure that kind of pulled all together, but with clinical clues that are sprinkled throughout each chapter. These clues link math concepts to clinical practice. This clinical clue appears after a dosage calculation example that yields 1.5 tablets. It was explained in the chapter that tablets or tablets must be scored in order to be divided. Since the example that precedes this clinical clue yields a divided amount, the student now learns that if the caplet is not scored, they should contact the pharmacist for a scored tablet. The example that follows this clue yields, as you see right there, yields 1 1/3 capsules. And the text will go on to say that the prescriber must be contacted for an alternate form of medication, like an elixir or suspension. And then the very next example utilizes that elixir. This text is designed to promote critical thinking. As previously mentioned, the approximation and evaluation steps in the case approach promote critical thinking. In addition, there are NCLEX style review questions at the end of each chapter, and these are high-level questions that require critical thinking skills. On the next slide, we'll see an example of an NCLEX review question. This text supports is by color coding use of measurements. We'll see examples of color coding in upcoming slides. Also, presenting all three methods next to each other in a table format may appeal to the visual learner. Here's an NCLEX style question. So you can see by looking at this question that the student not only has to perform a dosage to answer the question, but must be able to determine which devices are calibrated appropriately to deliver the ordered quantity. So the ordered quantity is going to be 2.5 milliliters or 1/2 teaspoon. Because multiple select questions are included on NCLEX, several multiple select questions are included with the NCLEX style review questions at the end of each chapter, and they appear after the homework. And we try to pick, if you look at this question, a low-dose syringe. Now, only insulin syringes come in low-dose options, but that might be an option that's appealing to an uninformed learner. So we try to really make them calibrations, questions that really cause the student to think critically. See, the next slide shows a color coding example. So we write the steps in color code. So the first step is to convert the dividend and or divisor to improper fractions. So the example is 3.5 divided by 1 3/4. So the first step is color coded in purple. So to do that, it's 7/2 divided by 7/4. The next step is invert the divisor. So the divisor, 7/4, is inverted to 4/7 and shown in red. Then we see the cancellation of terms. And once they're canceled, they're reduced, and that's in brown. And then we multiply the inverted divisor by the dividend, and that step is shown in blue. And then the answer is shown in bold and in black. And we believe this will aid the visual learner. The next slide shows us reviewer feedback. Next slide. Thanks. The feedback from our reviewers was overwhelmingly positive. We're extremely grateful for our reviewers because they gave us a lot of constructive feedback, and whenever and wherever possible, we incorporated their feedback into this text. One example is that reviewers that favored the linear ratio proportion approach really felt strongly that it should be in the text, so we included both the fractional approach and the linear approach. We've captured some of the most frequent comments made by reviewers on this slide. So they're self-explanatory. And having taught dosage calculation as a standalone course for years, the text was created with that in mind, but some of our reviewers were people that taught pharmacology courses, and they felt that this textbook would be a really good companion for a pharm course. So we felt really encouraged by that. Student feedback is our next slide. Most students will agree that learning 3 approaches is confusing. With all of the approaches presented together as they are in this text, a student can zero in on their favorite approach and either ignore the others or readily see how it compares to the others. This presentation may also facilitate a student's ability to apply any one of the 3 methods rather than just learning one. common advice given by students to each other in order to promote success is to do tons of practice problems. This text provides ample practice problems. There's learning activities after each new concept is taught within the chapter. There's 50 homework problems at the end of each chapter. There's an additional 30 interactive and quiz problems per chapter available online. A math proficient student provided the third quote. Some students will find the chapter summary a helpful starting point as it provides an excellent outcome-based overview of the material presented in each chapter. Students limited by time will be assisted by this summary as it will help them determine the learning outcomes on which they need to focus. And because all the homework exercises are referenced to learning outcomes, students can further limit their homework focus to their unique learning needs. Okay, a couple of tips on this slide. Using ratio proportion is a skill I think all students need to learn. No matter which method of dosage calculation, they need to mentally use ratio proportion to approximate, to perform their approximation step. A couple of tips to use this ratio proportion. A, maintain a consistent approach. For example, put the supply on the left and the order on the right. And when you do this for the first time, when they're first learning this method, label the supply on the left and label the order on the right. We've done that in the text, and we think this will help students learn how to properly set up equations. Tip number 2, to simplify the concept of dimensional analysis. We explain in the text that you form a bridge of known conversion factors to determine an unknown quantity. If I asked you how many seconds are in a week, you can readily solve this by using a series of known conversion factors. Although there's a lot of ways to set up a DA equation, we believe using the units of the unknown x is an easy way to guide the students through the equation. The first unit of measurement, color-coded in blue, indicates that the first factor should have seconds in the numerator. And the last factor should have, which is color-coded in red, should have week in the denominator. And every other unit of measurement should cancel out in between. So if we start with 60 seconds over 1 minute, then we know that the numerator of the next fraction has to be minutes. And we know, what do we know about minutes? We know there's 60 minutes in 1 hour. So then we know that the hours has to be the numerator of the next fraction. So hours cancel each other out. We know there's 24 hours in a day. So we know that days has to be the numerator of the next fraction, and we know there's 7 days in a week. Now our bridge is formed. All of the units of measurement cancel out except for the color-coded ones. And now I just multiply 60 by 60 by 24 by 7. And that gives me 604,800 seconds in a week. And so if you start with an example like this, it may be helpful to students. On the next slide, I'll apply dimensional analysis to a clinical calculation that I use all the time. But just to point out, dimensional analysis is gradually becoming the industry standard for dosage calculations because it minimizes the potential for met errors by incorporating all steps of a multi-step problem into a single equation. So if we look at the example on the next slide, Next slide.
Susan, this is Jen. I'm seeing dimensional analysis example. Is that the one you want to?
Yes, it's not showing on mine. Is it showing on everybody else's?
No. Oh, hold on just a second. Let's just see.
I'm seeing tips still.
Okay. Yeah, it could just be a WebEx problem.
Look at this example, which is something I use in the clinical setting all the time because I teach maternity. We have an order for Pitocin that starts at 1 millunit per minute, and the standard supply for Pitocin for labor induction is 30 units of PIT and 500 milliliters of D5 induction. So the students have to figure out how many milliliters per hour to set the pump to. Since the answer needs to be in milliliters per hour, we start with a factor that contains milliliters as the numerator, and we end with a factor that has hours as the denominator. So if we start with 500 milliliters over 30 units, we know that the next factor has to have units in the numerator. So we know that that 1 unit contains 1,000 milliunits. So that's our next factor. Thus, we know that the next factor after that has to have milliunits in the numerator, so that milliunits will cancel each other out. Well, the order is for 1 milliunit per minute. So 1 milliunit over 1 minute is the next factor. Thus, we know that the next factor after that has to have minutes as the numerator, and we know that there's 60 minutes in 1 hour. So now we have our bridge. All our units of measurement cancel out except for the color-coded ones, milliliters per hour. And we can further make this, simpler by cross-canceling 500 into 1,000. This goes in 2 times. And then we can multiply our numerators and get 1 times 1 times 1 times 60 is 60, over 30 times 2 times 1 times 1, which is 60. Or we can cancel everything out before that and get 1 over 1. Either way, we'll get our answer of 1 milliliters per hour. And we actually did this without a calculator, and it was a very simple way to answer a complex equation. Now, if we look on the next slide shows us that same example using ratio proportion. There it is. Okay. So you can see that it takes 2 steps to do the conversion and then a 3rd step to do the calculation. So whereas dimensional analysis does everything in one fell swoop, if we use ratio proportion, we have to do it in 3 steps. Okay, Jen, I think you're on now.
Great. Thanks, Susan. Thanks for providing such an in-depth overview of your textbook. And just wanted to talk a little bit more about Navigate 2, and I'm just going to advance to the next slide. So the Clinical Nursing Calculation text features Navigate 2 Advantage Access, and for those who are unfamiliar with this, it's an online resource which accompanies your course and this textbook. For students, it offers a free interactive ebook with animations, and in just a few minutes we're going to walk you through one of the animations as well as provide you with a complete list of the animations that will be available. In addition, students can learn from case studies, practice activities, and assessments that are all included within Navigate 2, and this product is free with any new textbook purchase. For instructors, Navigate 2 Advantage Access offers some resources to get you up and running fast, such as an instructor's manual, a syllabus, and learning objectives, as well as additional resources that you can use to customize your course, such as practice activities and assessments. It also features a gradebook, scheduling capabilities, as well as learning analytics and reporting tools right within the course shell so that you can see where students might be struggling with course content and then adjust future lessons appropriate and as needed. We do invite you to try Navigate 2 today. If you visit the website or the web page listed here at www.jblnavigate.com/tryitnow, there is a form that you can fill out, and we will give you demo access so that you can test drive the course. This website also features a few walkthrough videos to get you a little bit more familiar with some of the features. So we invite you to try that out today or whenever you have a few minutes. Susan, back over to you.
Okay, so to provide context to some concepts, we made animations available to students, and the ideas for animations came in part from concepts that students have a difficult time grasping. If you look at the list on the right, those are the list of animations that we provide. And all animations will reside in the ebook. But I know that reconstituting a medication is a concept that students have a difficult time grasping, so they can actually see it. Or when students are calculating a rate for a secondary IV, they may not really understand what that concept means. So we have an animation showing the setting up of a primary and a secondary IV, hooking the secondary IV to the primary IV. So that's just an idea of what we have available on animations. And Jen, you're going to show this animation now, correct?
Yes.
Okay.
To safely administer medications, pay close attention to essential information on the medication label. The generic name, also called the chemical name, is the single official name assigned to the drug in the United States. The generic name of this drug is renbenzine sulfate. If there is only one name on a drug label, it is the generic name. The trade name, also called the brand name or manufacturer name, varies from one company to another. The brand name of this drug is Renfisa. The form of the drug refers to its composition, which may be solid or liquid. Solid forms include tablets, gel caps, and suppositories. Liquid forms can be oral or injectable liquids, drops, or sprays. Other forms are topical, such as creams and patches. The form of this drug is a tablet. Dosage strength, also called supply, supply dose, or concentration, is the amount of medication in each dosage unit. Dosage unit refers to the quantity of solid or liquid in which the supply dose is contained. When the dosage unit is not specifically written, as in this label, the dosage unit is implied to be 1 tablet. The dosage strength of this medication is 400 milligrams per tablet. The route of administration is the path by which the medication enters the body.
Okay, so you can see, we didn't obviously complete the animation there. We just wanted to give you an idea what the animations are like. But this animation helps students determine that dosage strength includes both the supply amount and the supply volume, or the supply quantity, as in 1 tablet. It also aids in differentiating the dosage strength from the total amount, which is a typical source of confusion for students. Okay, Jen, why don't you wrap it up before we take questions?
Sure, thank you, Susan.